Thank you all for being here today. Today, I am announcing an emergency order that will jumpstart our efforts to address our homelessness crisis and the incredible behavioral health needs on our streets. I'm using my executive authority to drive our homelessness response system towards action and change on the ground so that the broad investments can quickly reach the people who need it most right now. This order establishes emergency procedures for procurement of goods and services related to addressing the homelessness crisis. It helps our departments urgently expand the homelessness and behavioral health investments approved by the Multnomah County Board on September 28th and through our recent corrective action plan with Metro. Because people in this community currently living unsheltered deserve our best effort right now. Our fastest response and our best response today. Our community needs new shelter beds. Our recent investments deliver nearly 400 new beds into our system, and our funding sustains 175 beds. With the 2,500 shelter beds that were included in Multnomah County's recent budget that was passed this summer, this will bring our total number of funded shelter beds to over 3,000. Our community also needs recovery housing and stabilization services. This fentanyl and polysubstance crisis requires an expedited response, including the 24-hour stabilization center recommended by healthcare experts and an urgent down payment on recovery-focused, supportive, and transitional housing. We need increased daytime services in response to the City of Portland's time, place, and manner ordinance, and these investments have to be implemented in time to change what happens on our street when this ordinance goes into full effect. We need expanded shelter options for families, for village-style shelters, for recovery-focused permanent supportive housing. We are making strong investments. Now we need to make sure that those investments reach the people who need them. Our community needs the city's task sites, and we need them to come online quickly and provide the wraparound services that help people stabilize and transition off the street and into permanent housing. But today's action is also about accountability. Through an expedited contracting process, we will continue to set importance expectations around the outcomes that these investments will produce. And we are requiring each contracted provider to track outcomes through our region's Homelessness Management Information Systems Database, or HMIS, which will further improve the Joint Office's by name list of people experiencing chronic homelessness in Multnomah County. Thank you, and I do have time for questions.
Just for Vega Pederson, how much money will the day centers pointed out like Rosehaven and Blanche House be getting?
So we have made a total investment of about $3.3 million for day services. The specific amounts for different organizations is yet to be determined, but we needed to do this. I needed to take this action in order to start that and get that money out the door.
Have you determined which shelters those will be?
So we have been in conversations. We have likely providers, some of those that have been mentioned, including Rosehaven, Blanche House, Equi Institute. So those are some of the ones that we'll be having conversations about. But again, I needed to take this action so that we could get that money out the door into those providers.
So looking forward beyond this money and as we continue to tackle this crisis, Commissioner Renee Gonzalez has asked for a public health emergency to be declared with this drug addiction crisis. Is the county thinking about possibly declaring a public health emergency when it comes to this so we can free up more money and cut red tape?
You know, when I was wanted to make sure that the investments that this board had taken with the over $60 million plus the corrective action plan spending that was voted on earlier this summer, I was looking at what are the tools that we need to do to make sure that those resources get out into the community. This emergency order really takes care of that by making sure that our procurement processes are not going to get in the way of getting that money out the door quickly. So this will help both with our homelessness services response system, but also with the behavioral health investments that we need to make.
Is this the first emergency order you've made as county chair?
This is.
A question relative to Blanche House and Rosehaven. they're scratching their heads saying, we've had conversations, we're sitting here, we still don't know how much money we're getting. And at the same time, they don't really have a lot of room to expand capacity in their current space. So what is really happening with this in terms of trying to say, well, once this ban of daytime camping is enforced, there's really not any room there at those two locations to really put many people.
Yeah. So we are looking at some of the people who have been providing services, how we can support the actual work that's happening, especially with the I think the level of acuity and the complex needs that people are approaching these services with, and what kind of resources they need to really help our community members. But we're also using these investments for daytime services to expand the reach of our day shelters as well. So we're looking to do that. And as I mentioned earlier, part of this is also asking our providers to participate in the HMIS system, so we have a very clear idea of the outreach, the engagement that's happening, and that is being tracked over our overall system. Again, that's about making sure that we have the data systems in place so that we know what's happening on the ground, and we're able to share that and be transparent with that information.
There's $500,000 allocated for a daytime shelter in North Portland. What are the details of that?
Yeah, so as we looked around the potential impacts of the time, place, and manner, and where there were existing services that we could invest in, we could expand in, where there were a lack of services, North Portland was identified as an area that had a lack of services. So now we're looking at potential places where we can make immediate investments to get something up and running, again, in time for the full implementation of the city's time, place, and manner.
But that's it's gonna happen in the next few weeks. So is there a building that's identified that the city owns or county owns? I mean, can you give us more details since this is all gonna happen pretty quickly?
I can't give you more details right now, but as soon as we have details for share, we will do that. We are looking and have been engaged with the community for a while in terms of what is looking like places where we can get into right away and get services up and running as soon as possible to align with the implementation.
And has the mayor provided you or the county with any updated timeline of time, place, manner implementation that continues to remain sort of an open question?
Yeah, I mean, we had some conversations with the mayor's office, and I think we don't have any more specific information. So I think my concern and the reason why I directed our COO and our county departments to really take a look at this is I knew that there was going to be a expanded rollout of this, right? There was going to be a time for the actual enforcement of the time, place, and manner to go into effect, and I wanted to make sure that we at the county were doing our part to get services for the people who need that, who are going to be most directly impacted by the time, place, and manner, and that's really been my focus of getting those up and running. The need is there regardless, but I think the time, place, and manner just makes it more so.
Can you talk about what led to this decision? Was there a final straw, so to speak?
Well, in looking at, so the additional unanticipated revenue that we heard from Metro that we were going to get, and the sheer amount of it, $50 million, that was outside of our budget process, that actually happened for us to consider how we wanted to spend those dollars, was post our budget process. That, for me, it's very important that we get these dollars spent this fiscal year. So in order to enable that to happen, in order to get these investments in place, to get these dollars out the door, to be supporting that work, to be growing our shelter system, to be growing our services, this executive order was needed to make sure that that could happen. I didn't want the process to get in the way of the investments actually happening in a really timely, expedited manner.
And have you been in contact with the city about how you're planning to use this money?
Well, of course, because part of this these dollars were $16 million for the city's task sites. So we had the mayor come and testify. We've had other city commissioners come and testify in support of some of these investments. So yes, we've been in conversation with them, and they've been fully aware. I mean, that was, again, one of the things that was important to me, is that as we were making decisions about how we were going to be using these money, that was done in a public way, so that there was transparency about what these investments were looking like.
One of the things that became known this week is that the city lost a federal grant of $550,000 for a transportation service to a sobering center that the city says the county failed to build in time to receive this grant. Is this at all a reaction to this, the fact that you're trying to get ahead of using this money that's available?
Well, I'll say two things. One, like the desire to have executive order to make sure these money that is something that like my team has been working on for weeks to make sure that we could get this set up so that we could get those dollars out the door. So this is not in no way. I also have been really perplexed by the city's statement that the county is responsible for them not having a grant. They decided to apply for that grant when they were in charge of the process. They received that money like prior towards the county taking over. So their decision to go for that money there was when they were entirely responsible for that. There were, when those services were taken back into 2019, it was because that model no longer worked. And I think the city went forward with that thinking that they were going to be successful in the work that they were leading in trying to get that. That didn't happen. That wasn't a successful process. So when the county took it over, we really had the conversation with our healthcare experts, with the folks who were on the executive committee of what is this next investment that's going to be really critical to our behavioral health system, and how can we get resources on that. That is what this investment for the stabilization center is all about. The mayor, his staff has been a part of those conversations, have been a part of those discussions. So I really see these as very separate things, and I think it's unfortunate that they're portraying it in that way, because the timing of the grant, when it was when the whole process was under the city's responsibility, doesn't line up with kind of the work that's been happening since then.
What is the difference between a stabilization center and a sobering center?
Yeah, so a sobering center is a really limited duration place for people to go so that they can sober from whatever influence they're under. Traditionally, that has been alcohol, right? So you know the term drunk tank, right? It was a place where people could be picked up, they could go. It was a room where they had like a lot of cots, and people could really just sober up after a few hours. I think when the decision was made to stop the City of Portland funded sobering center was because the complexity and that was happening with people who were under the influence of different types of drugs was necessitated like higher levels of healthcare and management oversight. So that's why we are having 8 additional sobering beds come online later this fall that are going to be in a more healthcare focused settings, right? That's going to be something that Unity is working on. Providence is also looking at increasing their sobering beds early next year. I think that the difference between sobering is that it is usually like less than 24 hours. So usually it's about 23 hours. There are certain hold requirements, right, that might be related to that. The stabilization center is going to be 20 plus beds that people can stay in for a much longer period of time, anywhere from 30, 60, 90 days. So people really who have been in addiction, who have gone through treatment, who are coming out of sobering, have a more stable place to stay. Because one of the things that we're seeing of people, whether they're coming out of sobering or detox or an emergency department, is that when people are released out on the street, they go right back to a very unstable, unsafe situations where they're much more likelier to be needing services immediately again. And so that's one of the through lines of the conversations that's been happening, is that there needed to be a continuation of our system to give people places to go, so we weren't just releasing people out into the street. And I will say that a stabilization center is more a part of a kind of a behavioral health network. A sobering is more of a crisis response kind of first responder place.
So it's not a place that first responders can just take someone who's, say, having a mental health crisis or just suffered an overdose, and that's something that first responders have been calling for.
Yeah, no, a stabilization is different than that, but there's a recognition that we do need to have that, which why I think we have seen our healthcare partners make the investments in the 8 additional beds at Unity, and I think that there is going to be 9 additional beds that are going to be opening up in the upcoming months from Providence. So that is a recognized need, and as I didn't mention it previously, but there is $150,000 of the investments that is going to be a part of a process that Commissioner Brim Edwards will be leading around looking at the planning and the implementation of a sobering center.
So real quick, I'll just time check, 2 questions.
Okay.
Just looking at the money for sleeping pods and the expenditures, there's like over $1.25 billion for 50 sleeping pods. that pens out to about $7,000 a pod.
Mm-hmm.
How is that justified?
Well, I mean, that is I mean, you look at what's cost for the infrastructure investments for the pods, for the pads, and I think you'll see that would line up with some of the other investments that we're seeing for safe rest villages or the mini villages or other places where those kinds of structures are in place.
But they're just being added in where there's already existing safe rest village or task site. I mean, how can it possibly be $7,000 for that?
You know, one of the things when we were having these conversations about this task sites or even the safe rest villages, but especially the task sites, it was I didn't want to be setting up tent cities where people were going to be in a location where they really weren't going to be protected from the elements. They weren't really going to have that, like, the safety of having a door that they could lock, right? The investments in these pods are really giving people a place of their own where they can be safely sheltered off the street and they can have that security. They can also, though, be in a safer community to have those. So what we are looking at with these investments is expanding the capacity of those sites that are already in existence. So again, we can be all about getting these investments quickly up and running and available for people who are living outside. And that's really what this investment is about.
Do you question the price tag though?
I think these things cost what they cost, and they really, and I don't know if you've had a chance to tour them, but they are like, tiny mini homes for people to go in that have electricity and have heating, and they have a locking door. These are pretty good structures.
Last question.
And there have been legitimate concerns from people on the board and also community members about the county just throwing the money out the door, and legitimate concerns. So how is the county going to be tracking the success of these investments that you're giving across the area?
That is an incredible concern of mine. I mean, first of all, there's a couple of different things that are priorities for me. One was recognizing we have to do a better job of getting these dollars out the door, and then we have to make sure that the money that is flowing from the county through our investments are actually making a measurable impact on the ground. That is why for these investments, there are going to be outcomes tied to those. Even with an expedited procurement process, we are holding those providers accountable for those outcomes to make sure that they are having the impact, that we are getting these shelter beds up and running, that we are having these services in place. So that is something that I will be keeping an eye on, and the Joint Office will be keeping an eye on.
And when should the public expect some sort of report or data to be released publicly about the success or not success of this money?
Yeah, I think we will be making continuous announcements as we are awarding these dollars, as we are getting things up and running. I think that is really good news that I want to share as much as possible with the public.
Thanks all.
Okay, thank you.
Thanks.